Hello, students. Welcome back to our today's session, which is Demystifying Muscle Anatomy Part 2. In our Part 1, we have covered our upper limb and upper back muscles, right? Which was around 145 minutes where you guys started dropping. I totally understand. But this session, I will try to wrap up in 1 hour. Okay, so in our today's session, we are going to discuss about our core muscle and our back muscles. So in our promo video, you might have seen me talking about our core and back muscles. So many of you might have encountered that your senior therapist talking about core muscles, core stabilization exercises, back stabilization exercises, strengthening exercises. So what are all these exercises revolving around? These all are revolving around your core muscles. So what are your core muscles? Your core muscles are again different from your back muscles. They both are not same. People often use core and back muscles interchangeably. So it is not same. So we are going to study about the different core muscles and what are the action of those core muscles and what are the different back muscles and its action. So starting with the first slide, so what you guys can anticipate from this webinar is you are going to understand what is the muscle structure and function related to your core and back. So guys, there are many muscles which we don't know, which are present in our back. And we have studied it in our first year, something called as iliocostalis, longissimus, erector, spinae, multifidus, like that. But we do not know what is the exact action of that and what is the exact course or pathway which that muscle follows. So we will apply the concept of biomechanics, that is the plane and axis, in our today's session. And guys, whoever is participating or whoever is staying till the end will get a certificate of participation. Let me tell you one thing. In our previous session, you guys have not sent us your email IDs. So I want you guys to join the WhatsApp group, which our team members will be sharing in the chat. Join that WhatsApp group and please send us your email ID such that we can send you the certificate of participation. We are going to do this muscle anatomy course in three parts. Okay, whoever is attending all the three parts is going to get a special announcement or a special offer from Prakara. Okay, so please participate in all our three demystifying muscle anatomy parts. Last one, bounty for the quiz champion. So we are having quiz champion. Last time we have picked only 3. This time we will pick 10 participants. So please keep commenting the correct answers. We will discuss the answers at the end also. So let us start with our first question. Abdominal region is divided into how many parts? I just want to know your anatomy knowledge about our core. So that's the reason why I have kept this question in the first slide itself. How many parts is your abdomen divided into? Option A, 6. Option B, 8. Option C, 9. Option D is 12. Whoever knows the answer, please comment down in the answers in the comment section. We will check the answers in the last. Okay. So moving on to the first slide, quadrants and regions of abdomen. We all know that our abdominal region is divided into 9 parts through 2 midclavicular planes. So these planes which you are seeing here, this is a midclavicular line. This another one is also midclavicular line. So these 2 midclavicular lines and these 2 horizontal lines are dividing our abdominal region into 9 parts. So as you can see here, this is the right hypochondriac region. Why it is known as hypochondriac? Because it is present below the rib cage. So you can see that these are the ribs, right? These are the costal cartilages and these are the ribs. So for the ribs to get attached, it will get attached to these costal cartilages. So these are the costal cartilages attached to the sternum. So this is the manubrium, this is the sternum, and this is the xiphoid process. Okay. So there are attachments to the xiphoid process also. So why am I telling you all this is you have to understand the parts of this bone such that there are many attachments to these ribs and Coastal cartilages. So these are the coastal cartilages. These coastal cartilages gets your rib attached like this. Okay. So this is how your rib is getting attached. Okay. And posterior to this is the vertebrae. Okay. It is getting attached to the vertebrae posteriorly. So your vertebrae has, so this is a typical lumbar vertebrae which I have taken. How is this different from thoracic vertebrae? Thoracic vertebrae has this body smaller in size when compared to lumbar vertebrae. So this is a lumbar vertebrae. It has two transverse processes. So these are the transverse processes, and this is the spinous process of a lumbar vertebrae. So there are attachments to the transverse processes. Some muscles are getting attached to the transverse processes, and some muscles are getting attached to your spinous process. That's the reason why I am talking about this. And some muscles are even getting attached to the anterior part of the vertebra. That is your vertebral body. Okay. So your abdomen is divided into 9 regions. That is right hypochondriac, left hypochondriac, right iliac fossa, left iliac fossa, right lumbar, and left lumbar regions as shown in this picture. Okay. See, this is the surface anatomy of your anterior chest. Why did I write this? Because you have to understand where exactly is each rib present. So this is the clavicle, as you can see here, and nipples are present at the between the 5th and 6th rib. That is your 5th intercostal space. There your ribs are present. So I will show it on a model. As you can see here, these are the clavicle. Okay. This is the first rib, which is present directly below the clavicle. This is the sternum. These are the coastal cartilages from which your 7th, 8th, 9th, 10th, 11th, 12th ribs are starting. Okay, so from the coastal cartilage of 7th rib, you are getting all the other ribs downwards like this. So you have to palpate the ribs like this to get the understanding of 12th rib. Okay, so palpate it here. You will get a bony projection. So this is your rib. Okay, here your ribs end. Now, as I told you, you can take a reference of the nipples. Okay, so these are present between your 4th rib and 5th rib. Between these two ribs, in women, 5th to 6th. So this you can take it as a reference. So this is your sternum, this is your xiphoid process. So to your xiphoid process also, you have many attachments which I will be talking about. Okay, on the posterior aspect, you remember my Preeti, right? Last time. So the same thing I have drawn here. Okay, you have to first draw C7. If you guys are carrying notebook, please write down these important points, which is very, very important for your future references also. Because depending on this, I am going to take picture. C7 is the most prominent part in your neck here. Okay. After
I'm
C7,
sorry to interrupt.
T3.
Can you please unshare the screen, ma'am, because the case is not being shown properly. Yeah. Work.
So C7 is the most prominent part. After C7, you have to tap for T3. Last time I told you where exactly is T3 present. T3 is present at the spine of the scapula. So you have to trace the spine of scapula. If you are not understanding where exactly it is, just leave one finger. First write C7, put a finger is enough. So put one finger, write one. Then place another finger, write T2. One finger gap would be enough for each vertebrae. So you can do it that way. So first palpate where exactly C7 is. So T3 is exactly at the spine of the scapula. Okay. Then trace down. You can see the angle of the inferior angle of what? Scapula. So these inferior angle of the scapula are present exactly at the T vertebral level. Please make a note of it. T3 at the spine of the scapula. T7 is present between the two inferior angles of the scapula. So you are palpating it like this from this and like this on the another. It will be easy. So you can try it on your classmates or colleagues. Okay. After that, trace it down and write T12. The same way I told you, no, finger gap is enough. Then write L1, L2, L3, L4, L5. Between two PSIS, draw second sacrum. That is second vertebral, sorry, second sacral vertebrae. Okay, so how to palpate PSIS? PSIS is nothing but the dimples which are present on the back. Okay, so if you can and see, try it on your classmates or your colleagues, you can see two dimples on the posterior aspect. Those dimples are nothing but your posterior superior iliac spine. Okay, anterior superior iliac spine and anterior inferior iliac spine are present on anterior. On him, I cannot show. I will show it. I will show on this. Okay, so this is anterior superior iliac spine. This is anterior inferior iliac spine. These two will have a lot of muscular attachments for the lower limb. But for the upper limb, what we have to understand is iliopectineal line and this pubic tubercle. If you can see it very carefully, there is a projection here. This is nothing but your pubic tubercle. This is the pubic crest, because most of your abdominal muscles, core muscles, get attached to your pubic tubercle and pubic crest, also iliopectineal line. Okay, so this is your right side hip bone. Understood? This is your iliac crest. So some muscles also have attachment to iliac crest, which we are going to study now. Guys, I want you to make the notes of all the muscles which I am talking about, because the back muscles are very, very confusing. It took a lot of time for me to understand it. At the end of the session, I am going to share a PDF with you in which I have written all the muscles in an easy way for you to understand. Okay? But make sure you are taking notes of this and also try to draw the diagrams. So, this is the surface anatomy of your anterior chest and back. This is about the back, which I was talking about, T3, T7, T12, and the major bony landmarks which we have studied. Okay. Now, starting with, first we will cover the theory. What are the different layers of the abdominal wall? You know, right? Abdomen or any part of your body, but your abdominal wall has many layers. First is the skin. So first is the skin, then is your superficial fascia. Always remember, let it be any part. There will be skin first, then will be your fascia, which is your superficial fascia. Between all this, there will be muscles or organs, then there will be a deep fascia. So skin, superficial fascia, there are muscles. What are the muscles of your abdomen or core? Majorly, there is rectus abdominis, external oblique, internal oblique, transversus abdominis, pyramidalis. So these five are the major muscles which you will see in your anterior abdominal wall. After these muscles, you can see transversalis fascia, because transversus abdominis is the last layer of the muscle on the anterior side. That is the reason why you have transversalis fascia on the posterior aspect. I mean, anteriorly, but on the last, you will have transversalis fascia. Then you have extraperitoneal fat. Extraperitoneal fat is nothing but, before peritoneum start, peritoneal layer is nothing but the liquid covering layer which is present around your organs to protect and nourish your organs is nothing but your peritoneum. Before peritoneum, you have extraperitoneal fat layer. So what you have to understand is there is skin, there is superficial fascia. After superficial fascia, you have the muscles. What are the layer of muscles you have? The order is rectus abdominis, external oblique, internal oblique, transversalis abdominis. Please make a note of it. Then comes your fascia of that transversalis. Okay, extraperitoneal fat, peritoneum. So now, starting with the muscles of abdominal wall. Your abdominal wall muscles are divided into three parts. First is anterior abdominal muscles, anterolateral abdominal muscles, and posterior abdominal wall muscles. See, there's a difference. Anterior abdominal wall muscles are the muscles which are present on the anterior side. So these are the muscles, whatever muscles which are present on the anterior side. See, I told you I will apply biomechanical axes and planes to this, right? So draw a coronal plane. Okay, this is the coronal plane, this plane. This is the sagittal plane, this. Where the body is cut into right and left half is your sagittal plane. Coronal plane is a plane where your body is cut into anterior and posterior, right? Okay, so cut the body into anterior and posterior aspects. So when I am cutting this model into anterior and posterior aspects with the help of my coronal plane, this is the anterior abdominal wall. So whatever muscles which are present anterior to that coronal plane is your anterior abdominal muscles. Lateral to that, lateral to these muscles is anterolateral abdominal muscles. So these are the anterior wall muscles. These are the anterolateral muscles, and posterior abdominal muscles are not present on the posterior side of your vertebral column. No, that is wrong. It is present anterior to the vertebral column. See, this is vertebral column. This is vertebral column. This is the anterior to the vertebral column. This side is the posterior to the vertebral column, right? So whatever muscles are present anterior to this are your core muscles. Okay. Among these muscles, you have anterior abdominal wall muscles, you have anterolateral abdominal wall muscles, and you have posterior abdominal wall muscles, which are attached to your anterior side of the vertebrae. Whatever muscles which are present posterior to this becomes your back muscles. Okay. So your abdominal wall muscles are divided into three parts. Hope this is clear for you guys. So we are going to discuss each anterior abdominal muscles, anterolateral abdominal muscles, and posterior abdominal muscles. Guys, please make sure you write it in the same sequence in which I am showing you now. So starting with the anterior abdominal muscles. First one is rectus abdominis. Guys, you have seen handsome guys who are having six packs, right? So my Preeti doesn't have six packs, but still I have to manage with this. So you have these lines in the rectus abdominis muscle, lines like this, right? If you remember, these are nothing but the tendinous intersections of the rectus muscle, rectus abdominis. So there are two rectus abdominis, there are two rectus muscles. One is rectus abdominis, which is present here, and another is rectus femoris, which is present over here, which is a muscle present in your thigh. Okay. So we have discussed this question in WhatsApp group also, and I was very happy seeing the response because you guys are responding really well. So this is the rectus muscle. So this muscle, which you can see here, this is the rectus muscle. It has these lines, white color lines will be present. So this is your tendinous intersection of this rectus muscle only, rectus abdominis. This muscle is attached to a line in between, which is known as linea alba. So whatever muscles of your core are present, those muscles will get attached to this linea alba. Okay. So linea alba is nothing but it is a fibrous thickening. These rectus sheath, internal oblique, external oblique, transverse abdominis. So these muscles, they get thickened and they get inserted here in the middle part of your abdomen, which is known as linea alba. Okay. So this rectus sheath has the origin from where? It has the origin from the pubic symphysis and pubic crest. I've told you, right? I've shown it to you. It is the origin from the pubic symphysis. This is the, see, if I attach two bones, this will become your pubic symphysis. Okay. So this will take its origin from the pubic crest and from the pubic symphysis. So this is the pubic crest and this is the pubic symphysis. From here, the muscle will travel like this and it will get attached to the xiphoid process and 7th to 12th costal cartilages. You just see the way how this muscle is getting started from here and it is traveling all the way along to the xiphoid process and As it is attaching to the xiphoid process, you can also understand that it will also get attached to these costal cartilages. And I told you that 7th costal cartilage starts from here. So it will cover 7th, 8th, 9th, 10th, 11th, and 12th ribs. So origin is from here. Insertion is to xiphoid process and costal cartilages. What is the action of this muscle? When this muscle contracts, that is when it shortens, it will cause flexion. Okay? When this muscle contracts, it will shorten and it will cause flexion. Okay? So it is a trunk flexor. Okay. So this is the function of your rectus abdominis.
Students, there is a small technical issue. Kindly be with us. We are just resolving it. We'll be back in couple of seconds. I expect that everybody are understanding the webinar. So kindly be with us. We are back in couple of seconds. So whoever are having the doubts, I would request them to kindly post in our chat box such that we will be answering those questions for you. Fine. So I can see students participating well for the first question. Please keep up the same streak. We will be getting back to you shortly. Students, meanwhile, if you are having any doubts, I would request you to please post in our chat box so that we will be replying to you on the same and we can answer you the questions better.
Amir, shall I start?
Ma'am, yes, please go ahead.
Amir? Okay. So guys, coming to the next muscle, which is your pyramidalis. Pyramidalis also takes the origin from the It also takes the origin from the pubic symphysis and pubic crest. And this gets inserted into again the linea alba, which I have shown here. So it is a very short muscle. It is a very, very short muscle which starts from your pubic symphysis and it gets inserted into the linea alba over here itself. So when this contracts, it will not cause any movement because as it is a very short muscle, it will only help in tensing the linea alba. So it will make the linea alba tight. Okay. So this is about the pyramidalis muscle. So this is the pictorial representation of the rectus abdominis, which started here and it got inserted into the xiphoid process and your costal cartilages. Okay. Next is the pyramidalis muscle. Internet connection is unstable. Over the pubic crest and it gets inserted into the linea alba. Now, talking about rectus sheath. Rectus sheath is nothing but a covering, a layer which is present in the abdominal wall and it covers the abdominal muscles. So as you can see, this is the transverse section of the model, or you can say if I cut him like this, and when you are seeing it from above, you can see these following structures. So this is the anterior part and this is the posterior part, right? So this rectus sheath has covered the rectus muscle inside it. So we have a pair of rectus abdominis muscle, right? So these rectus abdominis muscle, anterior to that, it has anterior rectus sheath, which is formed by the three muscles. Those are your internal oblique, external oblique, and transversus muscle. These three muscles are the important core muscles. Okay. So if you can see very carefully here, there is an arcuate line which is present in your abdomen. So above that arcuate line is nothing. Arcuate line is nothing but an imaginary line where upper three quarters of your rectus abdominis. So these upper three quarters of your rectus abdominis is represented in the first picture. Below this, that is 1/4, remaining 1/4, it is represented in your second picture. So above this, you can see internal oblique muscle, external oblique muscle, and transversus muscle has given its aponeurosis to form a rectus sheath. Okay. So anteriorly, it has internal oblique muscle. Your external oblique muscle got divided into two parts and it went anteriorly as well as posterior to the rectus muscle. Third one is transversus muscle, which is present on the posterior side. And if you see the second image, in the second image, below the arcuate line, all the muscles aponeurosis run anteriorly. There is nothing on the posterior aspect. Okay. So this is about the rectus sheath, which I wanted to add a note of. Now, next question. What is the primary function of the rectus abdominis muscle? Your options are lateral flexion of the spine. I've explained you the action of rectus abdominis muscle, which is present on the anterior side. So whatever is present anterior to the coronal plane, it will cause flexion. Whatever is present on the posterior aspect, it will cause extension. Whatever is present on the side, it will cause lateral flexion. So what is the primary function of rectus abdominis muscle? Option A, lateral flexion of spine. Option B, flexion of thigh. Option C, flexion of the spine. Option D, rotation of the spine. Okay. Comment down the answers. We are tracking your answers. Whoever answers correctly, we have a prize for you. Now, what are anterolateral abdominal wall muscles? As I've told you, there are, your core is divided into three parts: anterior, anterolateral, and posterior abdominal wall muscles. Okay. So anterior we have covered two. Those are rectus abdominis and pyramidalis. Anterolateral are three: transverse abdominis, internal abdominal muscle or internal oblique, external oblique muscle. Okay. So these three are a part of anterolateral abdominal wall muscles. So now we will study each of them. This is very important, guys, because you will get a lot confused when we are talking about external oblique, internal oblique muscles. So how do you remember the orientation of external oblique? Where you guys wear aprons, right? So when you're wearing apron, how do you put your hands in your pocket? Like this, right? So this is how is the orientation of external oblique muscle, that is medially and downwards. Internal oblique has opposite. It will be like this, okay? Medially and upwards. So as the direction of the muscle fibers is changing, so will be the action. So external oblique muscle, as you can see in the picture, it has the origin from the external surfaces of ribs 5 to 12. So your 5th to 12th ribs has the origin of anterolateral muscle, that is your external oblique. So from 5th to 12th, you have the origin of external oblique and it gets inserted into the linea alba like this. As you know that the orientation of external oblique is like this, it will get inserted into the linea alba. So So it will get inserted into the linea alba. When this external oblique muscle contracts, just imagine, just create a 3D image in your brain that when this is getting contracted, when this muscle is getting contracted on this side, okay, it will cause same side flexion and opposite side rotation, because the orientation of fibers is like this, that it will cause, and it is not horizontal. If it is totally horizontal, it will cause ipsilateral flexion. As the fibers are vertical and it is oriented laterally like this, contraction of this will cause a movement like this, that is ipsilateral flexion and rotation. Ipsilateral flexion and rotation to the opposite side. So it will cause same side flexion and opposite side rotation. Understood? So this is the action of external oblique. External oblique has origin over here and it got inserted over here. Okay. Internal oblique will have origin here and it will get inserted like this. Okay. So this was about external oblique. Now coming to internal oblique. Internal, see, I have mentioned that thoracolumbar fascia has also the origin of these muscles. So thoracolumbar fascia is nothing but a diamond-shaped muscle which is present on your posterior aspect like this. So you have a diamond-shaped structure which is present on the posterior aspect of your body. So this thoracolumbar fascia has also the origin for the muscles which are present on the anterolateral side. So we have external oblique here, internal oblique inside the external oblique, again transversus abdominis. These muscles will take the origin from the thoracolumbar fascia also, which is present over here. Okay, so this internal oblique muscle has the origin from this thoracolumbar fascia, anterior iliac crest, which is present over here. Okay, so this is the iliac crest. Anterior to this iliac crest is your internal oblique muscles origin. So it started like this, okay, and it got inserted. It started like this and it got inserted over the ribs of all the it got inserted over all the ribs, that is first to 12 ribs. So it went like this, okay, and it also got inserted into the linea alba. So what is the direction of external oblique muscles? And internal oblique muscle plays a major important role in functioning of your trunk, because external oblique has the orientation like this. So when right side external oblique contracts, it will cause ipsilateral flexion and contralateral rotation when your external oblique contracts. When your internal oblique contracts, it will cause ipsilateral flexion and ipsilateral rotation. Okay, make a note of this point about internal oblique and external oblique. If there is bilateral contraction, that is contraction on both the sides, it will cause flexion of your trunk, and it will also compresses the abdominal viscera, whatever it is present, that is stomach and all. So those abdominal viscera will get compressed when the muscles on both the sides get contracted. Unilateral contraction, as I told you, that same side flexion and same side rotation for internal oblique. For external oblique, it is same side flexion and opposite side rotation. Okay. Next is transversus abdominis. Transversus abdominis, it has the origin from the costal cartilages. So these are the costal cartilages 7 to 12. So from 7th to 12 costal cartilages from the thoracolumbar fascia and from anterior iliac crest. From all this, it has the origin like this, and it gets inserted into the linea alba as well as the pubic crest. Okay, so it has an origin from the 7th to 12th costal cartilages. Your thoracolumbar fascia, which was, see, anterolateral muscles have the origin from the thoracolumbar fascia. But for rectus abdominis and pyramidalis, you don't write that it takes the origin from thoracolumbar fascia, because it is totally opposite to thoracolumbar fascia. As these are present, as the anterolateral abdominal wall muscles are present here, it takes the origin from the thoracolumbar fascia that is present here. Okay, so this takes This takes the origin from 7th to 12th rib, thoracolumbar fascia, and also the anterior iliac crest, like this. And it gets inserted into the linea alba, pubic crest, and anterior pectineal line of the pubis. So this is the origin and insertion of transversus abdominis. What is the action of this? Bilateral contraction, that is the contract. This is a more horizontally present muscle. So when we are contracting it like this on both the sides, that is bilateral contraction, it will compresses your abdominal viscera and it will help in expiration. Obviously, all the core muscles will help in expiration. Unilateral contraction will lead to ipsilateral rotation. So contraction on this side will cause rotation to the same side. Contraction on this side will cause the rotation to the same side. Only contralateral rotation is done by your external oblique muscle. Okay. So this was about the transversus abdominis muscle. Next, question 3. During a movement that involves rotating the trunk to the left, that is, you are rotating, this is my right, this is my left. I am rotating the trunk to the left. Okay. So for this left rotation, which of the following muscles contract? A is left internal oblique. B is right internal oblique. C is right external oblique. D is both A and C. So what do you think which is the correct answer? Okay. So what do you think is the correct answer for this? External oblique, internal oblique? Okay. Now, I just want to see, I have added a question of thoracolumbar fascia. Why did I do that? Is I want to know what is your knowledge about thoracolumbar fascia. So another question popping up here is, what is the primary action of thoracolumbar fascia? Option A, it helps in facilitating breathing. Option B, it provides protection to the internal organs. Option C, it acts as a shock absorber during walking. Option D, it provides a site for muscle attachment and support in the lumbar and thoracic region. Technically speaking, all the answers are correct, but read my question properly. What is the primary action of thoracolumbar fascia? Major action of thoracolumbar fascia. Okay, I will talk about this. So, see, thoracolumbar fascia, I'm not going to go in depth about this. Thoracolumbar fascia is nothing but a diamond-shaped structure which is present on your back, right? And it has 3 layers. Anterior, as you can see in the picture, it has anterior layer, middle layer, and posterior layer. What you have to understand is, between anterior and middle layer, which muscle is present? Between anterior and middle layer, you have quadratus lumborum. Quadratus lumborum is a very important muscle which we will study in our further slides. So quadratus lumborum is present between your anterior and middle thoracolumbar fascia's layer. Okay. Between your middle and posterior layers, you have 3 muscles. Those 3 muscles are multifidus, iliocostalis, and longissimus. So erector spinae, about erector spinae also we are going to study because it is present posterior to your vertebral column. Okay, this is the vertebral column, right? This is the vertebra. Anterior to that will become anterior, or anterolateral to that will become your core muscles, or anterior abdominal wall muscles. Posterior to your vertebrae will become your back muscles. Okay. So now let us start with posterior abdominal wall muscles. Posterior abdominal wall muscles. Okay. I will tell you the answer for that question, thoracolumbar fascia. Option D is the correct answer because it helps in supporting, stabilizing, and it also gives attachment to the major group of muscles. Posterior abdominal wall muscles are not the muscles which are present on your back. I've told you, right? If this is a vertebra, posterior to this are your back muscles. Anterior to this vertebral body are all your abdominal muscles, posterior abdominal muscles. So this has psoas major, minor, iliacus, and quadratus lumborum. We have studied abdominal wall under 3 headings. First is anterior, anterolateral, and posterior abdominal wall muscles. Okay. So posterior abdominal wall muscles, major, minor, iliacus, quadratus lumborum. Let us study each one. So this is a pictorial representation of all the posterior abdominal muscles. Psoas major muscle. See, this I will show you like this. Okay. So this is the vertebra. So you can see many vertebrae here like this. Okay. Like this. So this psoas major muscle will take the origin from where? It will take the origin from the vertebral bodies. So these are the vertebral bodies. So it has the origin from these vertebral bodies, also from the intervertebral disc. So the green one which you can see here, these are the intervertebral bodies. So it takes the origin from these vertebral bodies, and also it takes the origin from the transverse process here. Okay, so these are the transverse process of the vertebrae. So these transverse process and these vertebral bodies will give the site of attachment to which muscle? To psoas major muscle. So 3 to 4, where's that? Psoas major. So it has the origin like this, guys. Literally, it has the origin like this. Okay. So it takes the origin from 3 to 4 vertebrae like this, and it gets inserted into which part? It will get inserted into your femur, lesser trochanter of femur. Okay. So this psoas major, when it contracts, right femur. Okay. Okay. So it will come and it will get inserted into the lesser trochanter. So this is the lesser trochanter and this is the greater trochanter. Okay. So this psoas major muscle will get inserted into the lesser trochanter here. Okay. So this, when this contracts, it will cause flexion. It will cause flexion of the thigh bone, that is your femur. So when this is getting flexed, that means it is getting contracted. So the major muscle which helps in hip flexion is your psoas major, also iliacus. Okay. And it also helps in external rotation. See, according to our biomechanics theory, when we are applying biomechanics, it is present when you are drawing a line, it is present medially, right? So when it contracts, it should do internal rotation, and it should also do adduction. But no, it does the opposite movement. It causes external rotation. How is this possible? How is this muscle when gets contracted is causing external rotation? Because it is present medial to the midline, right? This is not the anatomy of psoas major. What happens is it will pass the it will cross this. It will cross this anterior, superior, and inferior iliac spines, and it will go like this. It will come, literally, it will come like this. That is, it is crossing this and going. That is, it has a orientation like this. The course is like this. So when a muscle is contracting, when this muscle is contracting, it will cause external rotation because it is crossing it like this. Had it been like this, had the path been like this straight, it would have done internal rotation, but it crossed like this, okay, above from the pubic symphysis. That is the reason why it is causing external rotation. I will show it in the picture. You will get a clear idea there. Okay, so see, in this picture here, you can see that the psoas major, psoas minor, and this iliacus muscle, they take the origin from iliac fossa. Iliacus muscle takes the origin from the iliac fossa. This is nothing but your iliac fossa. Okay, from here, it takes the origin and it goes down and it gets inserted into the lesser trochanter. Iliacus, psoas major, and psoas minor muscles go and gets inserted into the lesser trochanter, and when they contract, it will cause the flexion of hip and external rotation of thigh. So this is about psoas major, psoas minor, and iliacus muscle altogether. Major muscle is your quadratus lumborum in your posterior abdominal wall muscles. That is not your back muscle. It is the posterior abdominal wall muscle. So it starts from, see in the picture, it is clearly shown. It starts from the iliac crest. So you have to remember whether the muscle is going down to up or up to down. Okay. Because if it is going from up to down, it will cause flexion of the trunk. Okay. And also lateral flexion if it is contracting unilaterally. If there is bilateral contraction, it will cause flexion because it is anterior to the coronal plane, right? So quadratus lumborum originates from iliac crest, anterior iliac crest or posterior iliac crest. It will be attached in the middle and a bit posterior, not completely posterior. As you can see, this is the anterior side and this is the posterior side. Okay, it attaches to the iliac crest and it gets inserted into the inferior border of the 12th rib. You can see this is the 12th rib, right? So this 12th rib and also to the transverse process of the L1 to L4. So it has the insertion to the lumbar vertebrae also. If you cannot remember the lumbar vertebrae or any like L1, L2, L3, you can write that it gets inserted into the lumbar vertebrae. What does this muscle do? As it is present on the side, as it is present like this over here, when this contracts, the unilateral contraction will cause lateral flexion of the trunk like this. Okay, bilateral contraction on the both sides, if it contracts, it will cause trunk extension because it is a bit posterior to the iliac crest, as I've told you, right? So it will not help in flexion, but it will help in extension of the spine with the help of other extensors of the back. Okay. So bilateral contraction will cause, it will fix the ribs. That is, as it is getting inserted on the 12th rib, it will fix that rib and it will help all the other muscles to extend. Okay. So this is about the quadratus lumborum. See, many patients will come to you with the complaint of back pain. So why we are studying about all these major muscles as well as minor muscles is there are special tests for each and every muscle. So you have to study those special tests also. To understand those special tests, you have to understand where exactly the muscle is located, where exactly is the origin, because all the back pains are not IBDP or not disc issues or sciatica or piriformis syndrome. Okay, some are related to the muscle spasms also. So you can study it in this way. You trace the course of the muscle. Next question popping up. Which of the following muscle is deep to the quadratus lumborum? This I haven't discussed yet, but I think you can answer this question. So quadratus lumborum is the deepest muscle, right? Among the posterior abdominal wall muscles. Below quadratus lumborum, which muscle is present? Erector spinae, transversus abdominis, external oblique or internal oblique. As you have studied about all the oblique muscles priorly, you will be able to answer this question. So which of the following is the deep to the quadratus lumborum? Okay. Now, let us start with the muscles of back. We have studied muscles of core till now. Now, what are the different muscles which are present on the back? Muscles of back are divided into superficial, intermediate, and deep. Please make a note of this. Make a flow chart where you will write that muscles of back are divided into superficial, intermediate, and deep muscles. Superficial muscles we have already studied, which we have studied in our Demystifying Muscle Anatomy Part 1. Superficial muscles, trapezius, levator scapulae, your rhomboids, and your latissimus dorsi. So now we will study about latissimus dorsi. It is a major, largest muscle present in your body after trapezius. Intermediate muscles are serratus posterior superior and serratus posterior inferior. In our first session, we have seen that there is something known as serratus anterior, right? So if there is serratus anterior, there should be something known as serratus posterior. So serratus posterior superior is there. Then you should also know that there is serratus posterior inferior also. So intermediate muscle groups are serratus posterior superior and inferior. Next is deep muscles. Deep muscles, you have superficial, intermediate, and deep again. So make a note of this. It will be easy for your understanding. Starting with latissimus dorsi. Latissimus dorsi, as you can see in the picture here, it has four parts. One is the vertebral part, which you can see here. Another is the iliac part, which is present here. Next one is the costal part, that is, it has the attachment to the ribs also. It also has attachment to the scapular part. And all this will go and get inserted into which part? It will get inserted into humerus. Where in humerus? Intertubercular sulcus in humerus. We have studied, right? A lady between two majors, that is pectoralis major and teres major. So latissimus dorsi starts from your iliac, it starts from your iliac crest. It goes upwards like this. It has attachment to the 9th to 12th rib. It attaches to the inferior angle of scapula here, inferior angle of scapula. Where is inferior angle of scapula present? It is present at T7, right? So it goes like this. It goes like this and it gets attached to the intertubercular sulcus like this. So it will, from behind, it will go like this and it will get attached to the intertubercular sulcus of the humerus. Okay. Now, when this muscle contracts, it will cause internal rotation like this, because I'm coming like this, no? I'm crossing the midline and I'm coming like this. It will cause internal rotation, that is, it will rotate like this, okay, because I'm coming like this. So it will cause, when it contracts, it will cause internal rotation, arm adduction, that is this movement, okay, and arm extension. So this latissimus dorsi has three functions. You see the origin and insertion. It started like this. It started like this and it got inserted in the intertubercular sulcus, that is lady between two majors. Okay. Now, when it contracted, it caused internal rotation, adduction, and extension. Okay. This is about latissimus dorsi. I hope you understood latissimus dorsi. This is the major important muscle among your back. Next is serratus posterior superior. I've told you, right? There is something known as serratus anterior. Hence, there should be something known as serratus posterior superior. So, serratus posterior superior and inferior, you can see that they are present on the back and they are intermediate group of muscles. So, serratus posterior superior is starting from the C7 to T3 vertebrae. So, I have marked here C7. I have marked C7 to T3. Okay, only this much part. So, only three vertebrae, C7 to T3. From here, what is the orientation of the muscle? It is going downwards. So, it is going like this. And it is getting attached. It is going like this. It is going like this. Okay? It is going like this and it is getting attached to the ribs. It is getting attached to the ribs. It is not getting attached to the scapula. It is getting attached to the ribs which are present here. So let me tell you one more important point, that where are the ribs attached? So first rib is attached to first thoracic vertebrae. Second rib is attached to second thoracic vertebrae. Like that, all the ribs from R1 to R12 are attached to T1 to T12. Okay. So make sure you remember this. So it is attached to the spinous process. I've told you, no? So there are two parts. One is transverse process. These are the transverse processes and this is the spinous process. So whatever is attached to the spinous process, it will purely help in extension because it is immediately present in the midline. It is present in the center. These are the transverse processes, right? So when it is attached to the transverse process, it can help in lateral flexion. But when the muscle is attached to the spinous process, it will purely help in extension. So this muscle helps in elevation of rib. You can see, right, with the picture, when this is getting contracted, as it has attachment to the ribs, it will elevate the ribs. It will elevate the ribs. But posterior serratus, but if you see serratus posterior inferior, when it contracts, its origin and insertion is like this. Okay, it is getting originated from the spinous process of T11 to L2. From here, it is getting inserted into 9th to 12th rib. So when it contracts, it will depresses the rib. So you have to understand the pathway of a muscle. If you're understanding the pathway of the muscle, you will be able to understand its action. as the orientation of muscle fibers is like this. When it contracts, it will pull the rib downwards. But serratus posterior superior, its orientation was downwards like this. Okay, so when it contracted, it elevated the rib. So action of serratus posterior superior and inferior is opposite. When upper part contracts, it will elevate the rib. When lower part contracts, it will depresses the ribs. Okay. Now, time for the question. Sixth question is, which among the following muscle is not a part of superficial back muscle? We have studied, right? See, back muscles are divided into two parts. One is superficial part, another one is deep part. Between both of them is the intermediate part. So, deep muscles are also known as extrinsic deep muscles are known as intrinsic group of muscles because they are the pure back muscles. Superficial muscles or extrinsic group of muscles have migrated to the upper limb. That's why they are not true back muscles. So the question here is, which among the following muscle is not a part of superficial back muscle? So the answer, comment down the answer. We will talk about that muscle in a further slide. So deep may, we are going to study about superficial. We have studied, right? Deep may, there were three: superficial, intermediate, and deep again. So among them, see, we have studied about this splenius, semispinalis, multifidus, erector, spinae. There is something known as longissimus. I don't know whether you have read it or not. In my first year, I haven't read about all these muscles. I have read about all these muscles in my biomechanics. In our biomechanics, there is something known as kinematics and kinetics, right? And we have muscle groups also. In that, it will properly talk about all the muscles origin and insertion again in also biomechanical perspective. So we have studied about splenius capitis and cervicis. What is this? So write down that in among deep muscles, you have superficial again. And among superficial muscles, you have splenius capitis and cervicis. Capitis is nothing but the muscle which gets attached to your occiput here. Okay. So in occiput, you have superior nuchal line, inferior nuchal line. That is nothing but the external occipital protuberance. There you have the superior nuchal line and inferior nuchal line. There you have the attachment of this muscle. So whenever the muscles from the vertebral column will go and attach here, when it contracts, it will pull the head like this downwards. So it will become a pure extensor, right? So capitis has the insertion in the occiput. Cervicis has the insertion over the cervical region only. So let us study about these two. See, remembering or mugging up these things, these, number of vertebrae is very difficult. I totally understand. But end of the session, I will post a easy way to understand this in the group where I have written all these numbering of the vertebrae. So splenius capitis, as you can see in the image, so let me show it in the image only. All these muscles try to study by looking at the image itself. Spinous process of vertebrae C7 to T3. That is from C7 to T3. So these four vertebrae has origin for splenius capitis, C7, T1, T2, and T3, and it gets inserted into the superior nuchal line of the occipital bone and also the mastoid process of the temporal bone. So the origin is downwards and it gets inserted in the superior nuchal line of the occiput. So when it contracts, it will cause the extension of the neck. But if it is unilateral contraction, it will act like a sternocleidomastoid. That is, it will cause ipsilateral flexion and rotation also towards the same side. So this is about splenius capitis. Splenius cervicis, it has the origin from the lower part. As I told you, capitis is above. Capitis is something which is attached to your occiput. So it will be present on the upper side. But splenius cervicis, it will take the origin from the T3 to T6 vertebrae. That is the vertebrae which you can see here. So these vertebrae has the origin for splenius cervicis. It gets inserted into the cervical vertebrae. So the origin is from T3 to T6 and it gets inserted like this to the cervical region. That is why it is known as splenius cervicis. See, if you do not if you can't remember the exact origin and insertion of these muscles, you need not worry. At least try to write 2 to 3 levels of thoracic or cervical region. Again, the same action of this, that it will help in lateral flexion and rotation of the neck to the same side, and bilateral contraction will cause extension of the neck like this. Okay. So this is our splenius cervicis. So these two muscles are among the deep mein superficial wala. Now we will study deep mein intermediate wala. Okay. Now, question, bilateral contraction of splenius cervicis causes what? Guys, stay with me. I know this is a bit boring, but this is very important for your practicals also. In anatomy and biomechanics, guys, from first year and second year, please pay attention, because these small muscles plays a very important role in your biomechanics. Bilateral contraction of splenius cervicis causes what? First, extension of neck, side flexion of neck. Read my question properly. It is bilateral contraction of splenius cervicis causes what? Comment down the answers, we will discuss. You know the answer. Bilateral contraction of splenius cervicis causes what? Now, coming to intermediate group. So first we have studied superficial. Now we will study intermediate. Later we will go for deep. There ends your session. Okay. So intermediate group is also known as erector spinae. So we have heard our seniors, you know, talking about erector spinae muscle. So erector spinae muscle is not a single muscle. It is a group of 3 muscles, that is your iliocostalis, longissimus, and spinalis. Guys, whatever muscle which we are studying about, they are all in pair. 2 iliocostalis, 2 longissimus, and 2 spinalis. But iliocostalis again has 3 parts. That is iliocostalis lumborum, iliocostalis thoracis, iliocostalis cervicis. Longissimus again has 3 parts. Thoracis, cervicis, capitis. Spinalis again has 3 parts. Okay. So if you cannot exactly remember what is the origin and insertion, at least try to write the vertebrae. Okay. So iliocostalis, how do you remember all these muscles? See, don't get scared. I know this is very scary, but I will try to make it easy for you guys. So it has 3 parts, right? Iliocostalis lumborum, iliocostalis thoracis. So we will go this way. So the orientation of fibers is this way, like this. So all the extensors will have the orientation like this, from down to up. So when this contracts, it will pull the trunk into extension. So this point is very clear, right? That the orientation is like this. So when it contracts, it will pull the trunk into extension. Starting with iliocostalis lumborum. So it starts from the sacrum. Okay, guys, make a note of this. Do not follow this. You will get confused. It starts from sacrum. So it starts from sacrum here. Okay, your sacral bone. It starts from here and it gets inserted into R5 to R12 ribs. Okay, it gets inserted into R5 to R12 ribs, which are present over here like this. So from sacrum to the ribs, it is getting inserted. There is no involvement of other vertebra. So it is getting originated from sacrum and it gets inserted into R5 to R12. R is nothing but ribs here. Okay. Next is the iliocostalis thoracis. Iliocostalis thoracis has the origin from lower 6 ribs and it gets inserted into upper 6 ribs. Okay. So iliocostalis lumborum has the origin from sacrum. It gets inserted into lower 6 ribs. Okay. Iliocostalis thoracis has the origin from lower 6 ribs and it gets inserted into upper 6 ribs. Khatam, ho gaya. Next, iliocostalis cervicis. So it should has its insertion in the cervical region, right? So it starts from 3rd, 4th, 5th, 6th ribs and it gets inserted into the cervical region because it should have the insertion in the cervical region. Then only, see, it It started from sacrum, which is your vertebrae, right? It got inserted in the vertebrae, that is your cervical vertebrae. So remember it this way, that beach mein pura it is ribs. Okay, thoracic is totally ribs, origin ribs, insertion ribs. Lumborum is starting from a vertebrae, that is sacrum, and it is getting inserted into lower 6 ribs. Here it is getting iliocostalis cervicis is getting started from the upper 3 ribs, and it is getting inserted into the cervical region, that is C4 to C6. Here ends your iliocostalis. So iliocostalis is a play of what? It is a play of ribs. So write down this, that iliocostalis is a play of ribs. Now we will see the play of vertebrae. That is the another muscle. Okay, so bilateral contraction of this will cause extension and unilateral contraction because it is not attached to the spine. It is attached to the ribs. So when it contracts unilaterally, it will cause lateral flexion of the spine. Okay. Now coming to the next muscle, longismus. This is also same like what? It is also same like your iliocostalis. So it has this longismus muscle. Let us start this also from sacrum. Okay. So it starts from sacrum. It takes the origin from sacrum and lower 5 lumbar vertebrae. So do not follow this. Follow the terms which I am using. It starts from sacrum and it also takes the origin from lower 5 lumbar vertebrae. Sacrum plus lower 5 vertebrae, and it gets inserted into T1 to T12. That is, it has covered all sacrum, lumbar and thoracic vertebrae. So the longismus, which part? Longismus thoracic has the origin from sacrum and L1, L5. It covered all the thoracic vertebrae. So it will be present like this. So which part? It will cover which part? Middle part or side part? It will cover the transverse process. That is, I've told you, no? If this is the spinous process. Many muscles have origin at transverse process and insertion over the spinous process of the below vertebrae. But this muscle, longismus, has the origin from the transverse process and insertion also over the transverse process. That is, if I place it here. Okay, so this is the transverse process. This is the spinous process. It has the origin like this, and it gets inserted also to the transverse processes. Okay, so this is about longismus thoracis. Longismus thoracis had origin from sacrum and lumbar. It got inserted into T1 to T12. Next is longismus cervicis. It takes the origin from first 5 thoracic vertebrae. So T1 to T5, and it gets inserted into, as it is cervicis, it should get inserted into which vertebrae? It should get inserted into cervical vertebrae. That is C2 to C5. So you see C1 doesn't have muscular attachments. So you have to write C2. So C2 to C5, T1 to T5. So from here it started and it got inserted into the cervical muscles. When it gets contracted, it will cause the extension of your neck, head and neck. Which part? Your longismus cervicis. Next is your capitis. So as I told you, capitis bolte hi, you should get an understanding that it will get attached to your what part? Mastoid process or nuchal line. Here it is getting attached to the mastoid process. It starts from where? It started from your this T5, T4, T3, T2 till C5. It had the origin and it got inserted into the mastoid process. It got inserted into the mastoid process. So when this contracted, it caused extension bilaterally. Okay. This is about longismus. Next is spinalis. Spinalis, as the name itself tells you, that spinalis has the origin and insertion over the spinous process. Okay, it does not touch your transverse process. So it also has 3 parts. One is thoracis, another is cervicis, another is capitis. Only iliocostalis had origin from the lumbar region, that is lumborum or sacrum. So it had lumborum. Here it has thoracis, cervicis and capitis. So thoracis, as you can see, it takes the origin, guys, please make a note of this. It takes the origin from L2, L1, T12 and T11. So these four vertebrae has the origin for spinalis thoracis, and it will get inserted into the four vertebrae above that. Okay, it will get inserted into four vertebrae above that. T8, T7. You can, if you cannot remember T8 to T2, you write down that it is getting inserted one or two levels above that particular vertebrae, because whatever muscles which we are studying right now are getting inserted one or two levels above that. Okay, because all these muscles run down like this. They literally run down like this. So you can write that they are getting inserted into one or two muscles, one or two vertebral levels above them. So this is the easy way of remembering all the muscles. Okay, so capitis gets inserted into, it started from C7 and T1. Okay, from C7 and T1, and it gets inserted into the occiput here. Okay, it gets inserted into occiput. So when it contracts, it will also cause extension. Okay. Next, time for the question. Which among the following is not a part of erector spinae? I've told you that there are three major muscles which will help in, there are, erector spinae has three muscles which will help in erection of the spine to maintain the posture. Which muscle among them is not a part of erector spinae? Which among the following is not a part of erector spinae? Okay, coming down the answers, next we will study about the deep muscles. So among deep, see guys, deep में हमने कितने muscles पढ़े? We have studied three muscles, right? Three parts: superficial, intermediate, and deep. Superficial में we have studied about splenius cervicis and capitis. Intermediate में we have studied what muscles? Serratus posterior superior, serratus posterior inferior. Then intermediate में we have studied what? We have studied about erector spinae, right? Among them, there are three muscles. Now, it is deepest layer of the deep muscle. So, iske aage, you will not have any other muscle. So, these are the deepest layer of deep muscles. They are divided into four parts: semispinalis, multifidus, rotators, and minor deep intrinsic muscles. Intrinsic muscles are nothing but the muscles which originates there only and gets inserted in the vicinity itself. They do not travel the long distances. Your thenar, hypothenar muscles are the intrinsic muscles. Your lumbricals, your palmar interosseous, dorsal interosseous, these all are your intrinsic muscles of your hand, right? Like that, you have intrinsic muscles of your back, that is your spine. Those are interspinals and intertransversal. So coming to the semispinalis muscle is again divided into capitis, cervicis, and thoracis. So how are you going to remember the semispinalis? It starts from, see, you first write that it starts from T10 and it gets ended at C4. That is important first, from T10 to C4. If you can't remember all the parts, just at least remember that it starts from 10th thoracic vertebrae and it gets inserted into C4 vertebrae. After that, let us divide it. Okay, it gets divided into thoracis, it gets divided into cervicis, and it gets divided into capitis again. So it started from T10. So T10 से T6 चार vertebrae का हो गया origin एक. It got inserted into C6 to T4. मतलब ये पूरा part it has covered. So from T10 to C6, your thoracis was there. Okay, one level or two levels above cervical vertebrae, your thoracis got ended. Okay, next your T6, मतलब इसका half is T5 or T6. यहाँ से it went and it got inserted into C2. That is your cervicis. Okay, thoracis का origin होगा तुम्हारे thoracic vertebrae में ही, and it got inserted into what part? One or two levels of cervical vertebrae. Cervicis का भी start होगा half of the thoracic vertebrae. If you go back and see all the cervices and thoracis part, from half your cervices started and it got inserted at C2, C3 or C4 cervical vertebrae, right? Now coming to capitis, capitis also starts from T1, T2, T3 or from T6 and it gets inserted again into cervical region, upper cervical region. So this is about your semispinalis. Why it is known as semi-spinalis is spinalis. What was the difference? See, what is the major difference is spinalis matlab majorly spinous process. It has origin in the spinous process and it got inserted in the spinous process. Semi-spinalis matlab it starts from transverse process and it gets inserted into the spinous process. Matlab aise shuru hoga and it will get inserted like this. Aise shuru hoga, it will get inserted like this, like this, like this, like this. Okay, so semi-spinalis. Next muscle. Okay, question number 9. Where do the semi-spinalis muscle originate from? I have just told you the answer. It has origin from which part? Semi-spinalis originate from which part? See, it has attachment to both, but I have also told you that it gets originated from where and it gets inserted where. See, why do you have to understand about these muscles is when you are mobilizing the joints, when you are mobilizing the vertebrae, it is very important that which muscle is attached to the transverse process, which muscle is attached to the spinous process. Then you will be able to mobilize it properly, because there are spasticity or there are tightness of these muscles also, which you have to release. That is the reason why I am telling you all the muscles in detail. It's okay if you cannot remember all the vertebral levels properly, but overall idea of a muscle's origin and insertion is important. Okay, मतलब लंबोरम मतलब यहाँ था, thoracic मतलब कहीं यहाँ था, cervix मतलब यहाँ शुरू हुआ और cervical region में खत्म हुआ, capitis यहाँ शुरू हुआ, got inserted into the mastoid process or nuchal line occiput. Okay, next, multifidus. This is the very, very, very important muscle in your body. Multifidus and erector spinae are the major muscles which you have to study. Being a physiotherapist, you have to, if anyone asks you about erector spinae and multifidus, if you will not be able to tell about these two muscles, then you are not a physio, at least for me. Okay, because these are very important, because when you're training a patient, we focus on multifidus and erector spinae group of muscles. Okay, so multifidus, it had its origin from sacrum. See, multifidus is a long muscle. It covers all the vertebral levels. Okay, so multifidus has multifidus cervicis, thoracis, and lumborum. So it started from sacrum, L1 to L5. This is very easy to remember. L1 to L5, T1 to T12, all the sacrum, all the lumbar, all the thoracic it covered. C4 to C7. Okay, except upper 2, 3. It covered all the cervical region also. What is the insertion of it? It gets inserted 2 to 5 levels above it. See, abhi L5 se nikla. Okay, L5 se one fiber started. One group of fibers started. L5 se. It gets inserted 2 to 3 levels up. Yahan se L1 se ek aaya. It gets inserted into 2 to 3 levels up. Okay, so this is about multifidus ka origin and insertion. It has origin throughout the vertebra, but from which process? That is important. From spinous process or from transverse process? It starts from the transverse process. This is very important. Okay, and it gets inserted into spinous process like this, like this, like this. Okay, starts from transverse process, gets inserted into spinous process. Transverse process, spinous process. That is important. Okay, so it is also like semispinalis, but only spinalis has the origin from spinous process and insertion into the spinous process. So purest extensor of your back is spinalis. Okay, last muscle is your rotators. Rotators are divided into rotators brevis and rotators longi. Rotators brevis has the origin from T2 to T12. All the thoracic vertebrae, only thoracic vertebrae, T2 to T12. Okay, the rotators longus has the origin from T1 to T12. See, brevis is a shorter muscle, hence it started from T12 and it got ended at T12, T2 to T12. Okay, rotator longus एक step ऊपर से आया, that is from T1 to T12. From which process? From transverse process. So ये हो गया origin. Insertion, where is the insertion of that? One level above the origin. So it started from T12, right? Above, see, the fibers of T12 started like this. It got inserted into T11. The fibers of T11 started like this, and it got inserted into T10. The fibers of T10 will get inserted into T9. The fibers of T9 will get inserted into T8, like that. Okay. So this is about rotators. As you can see in the image, these are the small, small muscles. If these muscles will contract on this side, it will cause rotation towards the left side. If these muscles will contract, they will cause the rotation towards the right side. So these are about the rotators. Last question. The multifidus muscle is important for providing stability to which part of the spine? This is a very important question. I haven't discussed about this. I will discuss. Multifidus is important for providing stability to which part of the muscle? Cervical spine, thoracic spine, lumbar spine, or sacral spine? See, in low back patients, we also give them the multifidus strengthening exercises. So think carefully which part is we are giving strengthening exercises. Okay. So this was about today's webinar, where we have known our core and also the back muscles, all the back muscles. I hope you have taken notes, where we have studied about superficial muscles, intermediate muscles, and deep group of muscles. This understanding of back muscles and core muscles is very important. We also have our products, which includes BPT first year curriculum. I think, Amir, I think you can take over from here. Guys, we will announce our winners tomorrow, because we have taken the track of your, we have recorded all your answers. Tomorrow morning, we will share you the quiz. Guys, please join the WhatsApp group and mail us your email ID such that we can give you certificate of participation. If you are attending all the 3 webinars, we have a special announcement for you. And at last, we will put a quiz, including all 3 webinars. Whoever wins that will have cash prize. Okay. Amir, I think you can take from here.
Yeah. So can I please have the product slide on?
Okay, sorry. Yeah.
Firstly, good evening to all the students and the faculty who have joined this webinar. And I'm extremely happy to see that most of the students who have exactly joined has participated very well for the questions. I would request and I emphasize everybody to please keep on the same streak, such that this would be helping you to grow not only as a physiotherapist but also as a student for the continuing learning. And we at Prakara Learning are always encouraging the students in terms of giving them what they exactly require and making them flexible in terms of learning. In the same go, we launched the mini learning program for first years, which is just for rupees 399, in which they would be getting all the subjects and anatomy diagrams included in this. I'm just repeating it. Anatomy diagrams are included in this, so I would request you guys to explore our products. And we also have exam modules. This exam modules, whatever examinations which are exactly happening or are about to happen, we would be giving you a complete briefing of all the subjects. I can see most of the students across AP and Telangana, and of course South and North, have taken this product, and we have getting a lot of good feedbacks regarding the product and the launchment. And this is helping a lot of students score more in their examinations and giving them the proper direction to make them understand what the subject is all about. In this complete exam module, they would be getting the complete video lectures with the paper discussions and the notes in the form of PPTs. And also you would also be getting a mentor access, which or who would be available from morning 11 a.m. to night 8 p.m. If you're having any doubts, you can post in our WhatsApp group as well. And the winners, whoever have participated in the quiz competition, would be declared tomorrow morning. If there are any doubts, kindly revert back to our WhatsApp group. Fine. So I would be posting the link in our live chat. So kindly join our WhatsApp group and kindly uh, undertake the feast of learning. All the best, good night, and please take care of yourself, students.